Well, thank you everyone for joining so promptly. We'll get started now as it's 12 o'clock. So welcome to the Canadian Public Health Association's Infectious Disease and Climate Change Webinar Series. It's so nice to see so many familiar names joining us from our previous webinars, and thank you to everyone who's new for helping us kick off the spring 2020 edition of our webinar series, which will be exploring current and emerging infectious disease and climate change topics to share knowledge, research, and best practices. Before we begin, I want to acknowledge that the Canadian Public Health Association's office is situated on the ancestral and unceded territory of the Algonquin and Anishinaabe people. They've been the guardians of this land for millennia, and we are grateful for the example their stewardship provides. CPHA is committed to working with all First Nations, Inuit, and Métis people and their governments in realizing meaningful truth and reconciliation. Today's webinar, Epidemiological and Predictive Modeling of Recreational Water Quality Risks at Canadian Beaches, is brought to you by the Canadian Public Health Association through the Infectious Disease and Climate Change Project. I'm Jillian Pritchard, Project Officer with CPHA, and I'll be today's moderator. Before we begin, I want to take a quick minute just to let you know about some other infectious disease and climate change resources that we have on our website at cpha.ca. So some of you may know that we have a resource page, but we have also recently added new resources to it on infectious disease and climate change, and it holds a compilation of the most recent research reports, tools, and other evidence-based information regarding infectious disease and climate change in Canada. And one of the new reports that we've added there that I'd really encourage you to check out is Health Canada's Health of Canadians in a Changing Climate report, which was recently published. It has a whole chapter on infectious diseases, which is really worth a read. And if you're interested in learning more, in May, one of the webinars that we'll be holding will be with the lead author of that chapter, who will go into it in more depth. Just a quick overview of the Zoom. So all of our attendees are muted. So if you have any questions for our presenters or any technical difficulties, please type them into the Q&A box at the bottom of your screen. After the presentation, I will read out the questions for our presenters who will answer them. And we really love attendee participation, so we really look forward to hearing your thoughts and questions. Just a few quick notes that this webinar is being recorded and will be made available on CPHA's YouTube channel a few days after the presentation. And we'll also be sharing the presentation slides in PDF format in a follow-up email with all of our attendees. And we really love getting your feedback. So after the webinar, please fill out the 5-minute survey, which will open automatically in your browser once you close Zoom. We really appreciate it, and it helps us make our webinar series what it is. Our speakers today are from Ryerson or X University. We'd like to note that acting on recommendations of the Standing Strong Mashkowi-Kapowin Task Force, Ryerson is currently undergoing a renaming process to guide commemoration and reconciliation efforts at the university. Our first presenter is Dr. Johanna Sanchez, a postdoctoral fellow at the School of Occupational and Public Health and the Dalla Lana School of Public Health at the University of Toronto, and an honorary research fellow at the Faculty of Medicine at the University of Queensland. She has a PhD in global health and epidemiology from the University of Queensland in Australia. Her research interests include investigating enteric infection and the effect on health outcomes, particularly in the area of water, sanitation, and hygiene. Dr. Jordan Tustin is an assistant professor in the School of Occupational and Public Health. She has a PhD in epidemiology from the Dalla Lana School of Public Health, University of Toronto, is a Canadian Field Epidemiologist Fellow, a CIHR Public Health Policy Fellow, a certified Canadian Public Health Inspector, and was awarded a Queen Elizabeth II Diamond Jubilee Medal for her service to public health in Canada and abroad. She has extensive field experience in communicable disease investigations and response, and her research interests lie broadly in the field of environmental and public health with special interest in communicable diseases. Our third speaker today is Dr. Ian Young, who is an associate professor in the School of Occupational and Public Health. He has a PhD in epidemiology from the University of Guelph and is a certified Canadian Public Health Inspector. He has previously worked as an epidemiologist with the Public Health Agency of Canada and food safety experts with the Food and Agriculture Organization of the United Nations. His research focuses on reducing the environmental public health burden of foodborne, waterborne, and zoonotic diseases through epidemiology, mixed methods, and research and knowledge synthesis research. And with that, I'd like to turn it over to our speakers for today.
Thanks, Jillian. I'm going to start, and I think Johanna will get the slides going. Great, thanks so much. So thank you so much for inviting us to come speak to you today about recreational water quality risks. So I'll start with the introduction background part, and then Johanna will talk about some of the study setting for our research project, go into some of the results of that. And then Jordan will talk about some of our future directions and conclusions. So why do we care about recreational water illness or recreational water quality? Swimming is an increasingly popular activity among Canadians. So we have seen statistics from Statistics Canada that have shown quite a bit of growth in that over the past couple decades as well. During the COVID pandemic, a lot of people were making more use of outdoor locations like beaches. So we have seen, and I think municipalities have seen, increases in beachgoer numbers over the past couple summers. As well, with climate change and more severe heat wave events being predicted in Canada, we would also expect that to have an impact on, again, increasing the number of people who are going to be using outdoor spaces like beaches in the coming years. So we're having increase in exposure to beach water and other beach exposures, and not just from swimming, but also other activities like kayaking, water sports, paddleboarding, etc., which can also have associated risks. So there's a large body of evidence globally that poor recreational water quality can increase the risk, particularly of gastrointestinal illness or enteric illness, but also other acute illnesses are also linked to beach water activities such as skin infections and even respiratory illness. And it's likely that these are quite underreported in Canada because, especially if they're sporadic cases, difficult to actually trace them back. And they often are self-limiting, and they may be misattributed to foodborne illness, for example, because they have similar symptoms. But data in the US indicates that as many as 90 million cases of rec water illness could occur each year, with a large societal cost and burden. And also in particular, children are at high risk of these illnesses. They have almost or more than double the rate of gastrointestinal illness in US studies. So that's another major concern from a public health perspective. So we do have many beaches in Canada. I think there's over 800 listed on the Swim Drink Fish website, which collates kind of the public beaches across Canada. So there's a lot of beach activity all across all of our provinces in terms of different types of beach sites and places where people are going in the summer. So beach water illness, rec water illness, is caused by a number of different pathogens, primarily enteric viruses, but also other bacteria, pathogenic bacteria and protozoa. But we use fecal indicator bacteria to actually monitor for the presence of fecal contamination in the water. And E. coli has been traditionally used across Canada in freshwater beaches. Enterococci are the main indicator used for marine beaches, but they can also be used for freshwater beaches. What we're talking about today is focused on E. coli data because that's the main indicator used in our study sites. So as many of you, I'm sure, are aware, in Canada, Health Canada sets the national Canadian recreational water guidelines. So the last official release was 2012. That is currently being revised, and the new edition was up for public consultation just a month or two ago. And this guidance document is used by different provinces and local public health authorities to guide their beach water sampling and surveillance programs in the summer. So in the what's going to be soon outdated edition, different threshold values were proposed that public health authorities could use to say if we're sampling our water in the summer, if the water quality comes back exceeding these thresholds, it indicates an unacceptable public health risk. So we had, if we have a geometric mean E. coli at a beach of over 200 or any single sample over 400. The new document that was just released for public consultation proposes to change that to a beach action value of any sample exceeding 235 would be recommended to have a public health action, such as issue a swimming advisory. So in terms of beach monitoring, that's done at the local provincial level, as I'm sure many of you are aware. In Ontario, for example, which is the focus of most of what we're talking about today, the research we're talking about today, beaches are monitored by public health units or boards of health through their water sampling programs and beach water assessments in the summer season. And that includes doing a pre-season assessment of beach water quality and pollution sources, as well as returning to the beach weekly, daily, or at different intervals to take water samples, assess beach and environmental conditions, and then those results are used to inform risk management and communication, such as signs for the public to advise them of high E. coli levels that could put them at risk of illness, or in some cases, closures of the beach, depending on what the actual risk involves. So in terms of the actual process of sampling, this really differs by the particular jurisdiction. So different public health units in Ontario, for example, have different frequencies of sampling. Some are doing it every day, some sampling their beaches once per week, some once per month, or some less often. So it really depends on the local situation, popularity of the beaches, and also historical results. So are those beaches consistently very good quality or consistently very poor, or is it quite variable? In Ontario, that guidance is provided by the ministry in terms of the procedures for how to do the beach sampling, which I won't get into the details too much today, but typically it involves taking 5 water samples per beach. So there are some limitations to the current approach that's used in Ontario and also other provinces in Canada. We are currently relying on culture-based lab methods to process the E. coli or enterococci samples, which can take a day or so to process. So public health authorities are making their decisions about whether the beach water quality is safe or not based on the previous day's actual E. coli result, which is not the ideal situation. And these delays can, again, result in risks to swimmers because we know that water quality conditions can change much more rapidly than within a day. So it's important to understand the environmental factors that affect beach water quality that can help us to make more timely decisions. So one approach we can use, and that is being used by different jurisdictions in Canada as well as the US and other countries, is what's called predictive modeling. And these use different beach conditions, weather, and environmental parameters to predict what the real-time E. coli levels are at a beach based on the current and previous day, rainfall amounts and other environmental conditions. So our team, we're not going to talk about the details today, but our team recently published a systematic review of predictive models at freshwater beaches, and we found that these generally improved beach notification accuracy, but there's a lot of variability in terms of how these models are constructed, how they're, and in terms of their effectiveness as well, depending on the context. We also did a survey last year of Ontario public health units and found that very few of them were actually using predictive models. A couple were working to implement them, and a couple had investigated them before, but found that there was different challenges in terms of actually implementing these models, or they didn't have necessarily the resources or capacity to keep going with them. So Johanna will talk a bit more about the models later on. And in terms of the predictive models, what we're using is trying to get a better understanding of all the different environmental factors that affect beach water quality. As you can see in this diagram, there's many different factors, and a lot of them are interrelated as well. So trying to get a better understanding of how those, what are those relationships, and can we use them to improve more timely notifications? So Johanna will talk a bit more about each of these different factors, and I'll now pass it over to her.
Great, thanks, Ian. So I'll talk about the first phase of our project, which was set using Toronto and Niagara region data. So Toronto, as we all know, is the largest city in Canada with a population of over 5 million people, yet it has 11 beaches right essentially in the urban area. So it provides quite an interesting opportunity to explore beach water quality. Niagara region is another very interesting region. It's very large geographically, and it consists of several municipalities. It's a major tourist destination with over 14 million tourists visiting annually, potentially increasing in the past few years given the pandemic with a lot more local movement. And we included 8 beaches in the study based on completeness of data, but there are actually quite a few more beaches in the region. And so we had 2 research objectives for this first phase of our project. The first is to determine which climate and weather-related factors are associated with higher levels of E. coli in public bathing beaches over time. And I'll go over the results of that in a moment. The second is then to use the information that we learned from our first objective to develop user-friendly predictive models. And we aim to do this using a Bayesian network approach. I'll talk a little bit more about that in a second. For selected beaches to assist public health authorities in the risk management decisions. And so looking at a little bit more at Toronto, the map, it's quite interesting in that all the beaches are, as I said, located quite close to the urban center. We have a few kind of outlier beaches here, but they're all still urban beaches. We also have a few rivers that are flowing into Lake Ontario that we need to think about when we think about rainfall and such. And we have a few weather stations that we collected data from. But this is the distribution of our beaches. In Niagara, it's very interesting because we have 2 Great Lakes. We have Lake Ontario, we have Lake Erie. And so we have beaches in both lakes. Another interesting feature is that we have the Niagara River, very powerful river, obviously given due to Niagara Falls. And then we have the Welland Canal. So we have a lot of movement of water happening between these 2 lakes that also needs to be considered when we're looking at environmental factors. And again, a big dispersion of our beaches in the region. So a very interesting region to look at as well. Overall, here's how all the participating beaches are distributed. We see the 2 Great Lakes. We have the ones clustered around Toronto, and then the ones spread between Niagara region. In total, there were 11 Toronto beaches and 8 Niagara beaches included in our analysis for a total of 19. And we use various weather station data, buoy data in the lakes. And we also used data from sensors in our rivers and UV station from NASA. So looking at our data across time in Toronto, we were able to obtain data from 2007 to 2019 from the Toronto Public Health. And we can see that there's quite a variability between the beaches throughout time. Green, for example, represents one beach. We can see that they reach higher E. coli levels annually earlier on, kind of coming down a bit at the end, but we can see that there's variation happening between beaches. Similarly, in Niagara, we sort of see that as well, that there's a bit of dispersion of the data. But another way we can look at this is by looking at exceedances. So if we have this also by beach, but here we're looking at this at overall level. So looking at all Toronto beaches, what was the percentage of days they exceeded 200 milliliters per CFU of E. coli? We can see that Toronto actually has improved through time, but quite good, surprisingly. I think there seems to be a general perception out there that Toronto beaches aren't clean, even among Torontonians themselves. So it was quite surprising to see how well they've actually done overall. And so only like 10% essentially being the highest that they've exceeded on an annual level. In Niagara, we see a bit higher numbers being approached there, but dropping off a little bit in recent years. And so talking a little bit about these specific data variables that we were able to include in our analyses. So we collected data that was publicly available. But by that, I mean it either came from federal data, so Environment Canada, or we were able to get it from conservation authorities, or even NASA in the case of our UV data. So we collected air temperature, water levels of the lakes, stream discharge of the various rivers that I mentioned, wave height, UV, as I said, from NASA, and then also rainfall data. In addition, the public health units collected some of their own variables. Toronto, for example, obviously has the E. coli data that they've provided to us, but they also do a visual observed count of waterfowl present at the time of collection of the water sample. And they also do a visual assessment of the water clarity. So for example, if the water looked clear or murky, they do a visual assessment as well, the person who's collecting the water sample. In Niagara, similarly, they also provided us with the E. coli data, but they also measure turbidity using a turbimeter, and they measure shore wave height as well. There were a few other variables that the two units measured as well, such as air temperature, water temperature, but we used the publicly available data for those points. So we used two methods for our objective one. The first is called path analysis, and the second one is multi-level modeling. Path analysis was conducted for our Niagara region data. And what this analysis methodology allows us to do is to examine the relationships between variables. So Ian showed you the various variables and how they potentially relate to E. coli, but we also want to see how they connect with each other. Maybe they're not acting on E. coli in isolation, but they're influencing each other. For example, increased rainfall could have an effect on stream discharge, we hypothesize. So this type of methodology is really interesting because it allows us to explore those relationships. And then multi-level modeling, we looked at the two regions and compared Toronto and Niagara and sort of explored the direction of the relationships of the variables. So I'll talk about these. So when we think about the environmental variables, we can't just, throw them into a model with the same day data. We have to think about, was there a temporal relationship? So for example, rainfall, it matters what happened the days preceding the date of collection. Not necessarily that it's raining right now, but perhaps that it rained heavily for the previous 2 days. So based on the literature, we made a decision to look at 48-hour cumulative precipitation. For UV index, we looked at preceding day UV index, same with air temperature, wave height offshore, so in the buoys, and as well as E. coli the preceding day. And the reason we did E. coli in the previous day to predict current day E. coli, because that's actually what's being used by current public health units, as Ian explained. We base decisions about current water quality status based on what was collected the previous day. So we included that in the models as well. And then for same day data, we included current stream discharge, turbidity at the time of collection, and shore wave height. So that's just to give you a sense of how we included the variables in the model. Now, our overall Niagara path analysis results represent all the beaches that were included in the Niagara analysis. We did conduct these for every individual beach, but for the sake of time, we're just going to look overall because we did see trends across all the beaches. So here's what a path diagram looks like and what it shows us about the relationships that occur between variables. So for example, we have 24-hour air temperature that has a positive association with E. coli concentration. This means as air temperature goes up, we're seeing a higher E. coli concentration. However, that also has a relationship through its effect on stream discharge. So as air temperature goes up, it actually decreases stream discharge. However, stream discharge has its own positive effect. So that could actually be nullified. And then stream discharge has its own direct association with E. coli, but it also has an association with E. coli concentration through its effect on turbidity. So it has a positive effect on turbidity. So increased stream discharge, we see increased turbidity of the water. So more murky water, which is not surprising as we see more river flow. We do expect that that would disturb the waters in the beach areas, specifically those that are located near streams. And turbidity itself has its own positive association with E. coli. So increased turbidity was predictive of a higher E. coli concentration. So that's what's really cool here. We're seeing like very different pathways happening here, and all that kind of gets accounted for together in these models. The preceding 24-hour E. coli also had its own direct effect on E. coli concentration, a positive one, so increased 20 E. coli the preceding day was in fact associated with increased E. coli, as we expect and as public health units are using now to make their determination. But it also had an effect on turbidity, which again has an effect. So we're seeing that it kind of has a double positive effect here, indirectly through turbidity and directly through E. coli. Rainfall acting on its own to have a positive association on E. coli, surprisingly did not have statistically significant associations through other variables as I expected. We expected it would have an effect on stream discharge or turbidity, but in the Niagara region, we did not find that. UV index had a negative effect on turbidity, and we have two different wave heights that were collected in Niagara. We have the ones that are offshore in the buoys, very, very far offshore. And then we have those that are collected right on the shoreline, essentially close to where people are swimming. So this is the same day shore wave height. So the shore wave height, right on the shoreline, essentially where people step into, close to where they step into the water, that had a positive association with E. coli concentration. It was quite a significant one. So it seems to be quite an important variable in determining E. coli concentration. And also higher shore wave height was associated with more turbidity. Not surprisingly, we see more wave action stirring up the water. Interestingly though, offshore wave height, so sometimes kilometers away from the beach, was negatively associated with E. coli concentration. And in order to really understand this, we have to get into sort of water engineering dynamics, that sort of thing. But there's a potential flushing effect that happens when you have more offshore wave activity happening, where it's actually potentially pulling out water from the beach and potentially even having a negative effect, as we're seeing here. So that could potentially explain that. But that does still affect turbidity. And turbidity itself has a positive association with E. coli. So the results of this analysis are actually published, if you would like to read more about it, where we actually present their specific beach models. So as I presented there, we see some of those trends are present at all the beaches, but we did see some differences at certain beaches. We found that, for example, turbidity was found to be an important mediator for the indirect effects of environmental predictors in all beach models. However, not all the variables were present in all of them. And what we were also able to determine is that we confirmed some of the relationships of environmental factors that we hypothesized or have already been described in the literature, such as positive effect of rainfall. We were able to confirm that as well. And so, as I said, we see differences between the beach-specific models that we did see in general trends. So again, our results are published in the Journal of Epidemiology and Infection, if you would like to read more about that. The other analysis that we conducted, as I mentioned, was a multi-level modeling analysis where we looked at both Toronto and Niagara. And we did this to really explore the two regions together, kind of see what direction of the relationships we're seeing between the two variables. And when I say direction, I mean, whether it had a positive effect on E. coli concentration or a negative effect. So overall, we saw that 24-hour air temperature, as we saw with the past analysis, an increase in air temperature meant an increase in E. coli concentration. We found this also for water level, for previous day E. coli, and for the shore wave height, again, consistent with the past models. Increased UV index on the previous day was associated with a decrease in E. coli concentration overall. So we thought that was also interesting and confirmatory of what we found in our past analysis. When looking at some of the differences between the models, we see that in Toronto, stream discharge was an important variable, an important predictor of E. coli concentration. So it had a positive effect. However, we did not find that in Niagara, as you can see here. which was interesting. But in Toronto, we have, the beaches that are located right in Lake Ontario, and the streams are flowing southwards into those beaches, essentially flowing into the beaches, where in Niagara, we actually have most of the beaches located in the Lake Erie side, and the water is actually moving northward, away from the beaches, through the Niagara River and the Welland Canal into Lake Ontario. So we're actually almost seeing a flushing effect happening in Niagara. But we did not find a statistic association there. We also found that 24 air temperature in Toronto and rainfall was positively associated in Toronto, but negatively associated in Niagara. So we thought that was interesting, but again, potentially associated with that flushing effect that we're seeing. Waterfowl count in Toronto was also quite an important variable for predicting exceeding a threshold of 100 or 200 CFUs per 100 mils. And then in Niagara, as we saw in the path model, shore wave height was a very important predictor. So beach-specific effects were significant in Toronto. And so what does that mean? It means that we saw some clustering of the data happening at the beach level. So it means that we were seeing some differences between beaches in Toronto. This was statistically significant. So it would suggest that there could be unique contamination sources and factors that affect E. coli level at the beach level in Toronto. However, we did not see this in Niagara. So in Niagara, we might see more of a general trend happening across the region, whereas in Toronto, it might be more important to look at this at a beach-specific level. And this is important information for us to know as we're building our predictive models. Again, the results that I just presented have also been published. This was published in the International Journal of Environmental Research and Public Health just in the fall, if you're interested in checking a little bit more about that. Now, we also conducted a telehealth analysis, just a preliminary analysis. I'll very briefly touch upon this for the sake of time. But essentially what we did is we linked our beach data with Telehealth Ontario data. And telehealth, this data is very helpful because it could represent an early warning syndromic surveillance system for AGI. For those of you that don't know, Telehealth Ontario is a service provided for people who potentially experiencing symptoms and would like to call in and speak with a nurse or health practitioner about potential symptoms and actions to be taken following, whether they need to actually go in and see a physician or someone. And so this is an opportunity for us to have data about symptoms. And so we developed models that looked at preceding extreme rainfall and AGI. AGI reported as vomiting or diarrhea to Telehealth Ontario. What we did is we lagged E. coli data 10 days prior to illness because we know that E. coli exposure 10 days in the preceding 10 days could result in illness. And then rainfall, we lagged it by 12 days because of that 48-hour cumulative rainfall that we like to account for. So essentially, the preceding 12 days and then essential exposure at any point in that time period. And then we controlled for some other environmental variables such as air temperature, stream discharge, mean UV index, and those were all lagged 11 days just to get that 24-hour preceding environmental exposure. So our preliminary results for Toronto and Niagara suggest that in Toronto, an increased previous day cumulative rainfall and extreme rainfall in the 99th percentile in the previous 12 days was associated with increased rates of AGI calls among adults. And in children, beach E. coli levels and heavy rainfall, as denoted as the 95th percentile, were associated with higher AGI rates. In Niagara, rainfall levels were higher actually than Toronto, and a preceding heavy rainfall in the 95th percentile was associated with increased rates of AGI calls in both adults and children. And beach E. coli levels, specifically at loud periods of 6 and 7 days, were also associated with AGI in adults and children. So again, our preliminary results suggest a relationship between preceding rainfall, beach water quality, and AGI in our study regions, and something we'd like to explore a little bit more. Our research objective 2, again, was to develop the user-friendly predictive models using a Bayesian network approach. And so briefly, using the information learned from objective 1, we aim to develop predictive models using what's called Bayesian network analysis, which is a type of artificial intelligence analytic method. And just to give you a preview of the predictive models that we're developing. So essentially here for Toronto, we're going above and beyond the path analysis that I told you about before, where we're looking at the intervariable relationships. Essentially, Bayesian network really does that too, looks at all the potential relationships that could exist between the variables, guided by us in addition to the computer as well. And from all the information gained, we already know sort of the relationships that exist, as well as the direction of those relationships. And we are currently in the stage of testing these predictive models, seeing how sensitive and how specific they are. Preliminary tests suggest that they're doing quite well for Niagara region. We haven't tested Toronto yet, but Niagara region is looking, well, Toronto and Niagara region are looking pretty good in the preliminary testing, and we've already started doing higher level testing for the Niagara region. And this is essentially what would be in the back end of any predictive models that are used by the public health regions. Again, they look quite complex, but it's really just because we're looking at the probability of these environmental factors on a given day. And I'll hand over to Jordan now to talk a little bit about our future direction.
Thanks, Johanna. That's great. So I'm going to briefly go over how we're moving forward with this research. The first one that you see is our geographic expansion. So we're very excited that with support from the Public Health Agency of Canada and our public health collaborators, we are expanding the research to sites in British Columbia and Manitoba. And this is going to allow us to increase the generalizability of the results and it be of wider benefit to Canadians, and also provide valuable information about marine beach water dynamics with our expansion to Vancouver. We'll also be evaluating the predictive models that Johanna spoke about in real time. So real-time testing of the predictive models and developing an online user-friendly app for these predictive models of water quality management system and website, and I'll get into that a little bit. And moving forward, we have a big plan for knowledge dissemination, knowledge translation, and developing this dissemination plan in collaboration with our partners in the public health units. In terms of our geographic expansion, as I mentioned, we'll be expanding to British Columbia and Manitoba, specifically with Vancouver Coastal Health in British Columbia, where Vancouver is the third largest city in Canada. And as I mentioned, we're excited to be able to expand to marine beaches in the Pacific Ocean, and also furthering our work with freshwater and popular Manitoba beaches, where in Manitoba, there's Canada's 6th largest freshwater lake. And in collaboration with our partners, we will be including 2 popular beaches from each of these sites. So I mentioned that we're going to be evaluating the predictive models that Johanna spoke about, and this will be done in real time. So real time testing them with our collaborators and the public health units to evaluate that accuracy of the metrics to determine whether the models are predicting the next day values. And this will really allow for real-time decision-making, generating those next day predictions and allowing the public health units to review trends. And with this, we're developing that online user-friendly application of water quality management system using something that's called our Shiny to develop this application. And then, as I mentioned, testing and validating the application with the collaboration of our health units, and also assessing the practical usability of the online application in a public health setting. And then finally, our knowledge translation. We will, as we have been, doing academic dissemination of our results through peer-reviewed publications, but also very much working closely with our collaborating public health units in Niagara, Toronto, Manitoba, and Vancouver to locally disseminate the results, in addition to other public health units throughout Canada, and to the public as well in terms of knowledge translation. And this will involve, again, collaborating with our public health units to develop a communication strategy, which could include infographics, and really making sure that the information is being shared among key users and the public and provides information that is concise and easy to understand. So in terms of our main conclusions, we've used several advanced statistical methods to further understand the relationship between environmental and climate factors and E. coli concentration at freshwater beaches in 2 of the Great Lakes. And as Johanna presented the results, we have identified key environmental variables associated with water quality, and we were able to gain a better understanding of the intervariable relationships. And we've used this information to develop predictive models using, as Johanna explained, a novel method, the Bayesian network approach, that we are currently finalizing these predictive models. And as I just went over, our future directions of expansion to other sites across Canada, developing these models further and conducting real-time testing at all of our 4 participating public health units, and having that online predictive modeling system and that knowledge translation and dissemination activities. Finally, we'd very much like to acknowledge our collaborating partners at Niagara Public Health and Toronto Public Health, who have been absolutely amazing to work with, and our future collaborators in Vancouver and Manitoba, and everyone that's involved in the data collection and management at each public health unit across Canada. Thank you.
That was wonderful. Thank you so much for your presentation today. It was so interesting. As an open water swimmer myself, I really appreciate the work you're doing to improve the predictive water quality, because yeah, it's very important to know what you're going out into there. Take a moment just to let our attendees know that now is the time for Q&A. So if you have any questions for our presenters, please type them into the Q&A box at the bottom of your screen, and then we'll go through those and answer them live. I've already seen quite a few questions come in, so I think we can get right into it. I've got one question here asking, could you comment on the expected consequences of climate change on beach water quality?
I can field that one. So I think, looking at some of the recent reports from Canada in terms of what are the potential environmental impacts on climate change, I think overall we could say there's likely to be more intense heavy rainfall events, higher frequency of heavy rainfall events that will impact things like stream discharge, which we saw has an effect on E. coli levels. Rainfall itself, can cause flooding issues. So I think with those kind of events, we could see more days where following those events, we have like big spikes in E. coli, fecal contamination of beach water. So then, also subsequent risks to swimmers. And also the other side of that is the increase in heat wave events, which is going to bring more people to the beach as well. And those could be linked to each other as well.
Great, thank you. Got one asking here, are cyanobacteria also a concern for beach water quality? As cyanobacteria are also a concern for beach water quality, could your model also try and predict cyanobacteria blooms?
So that's very true. Cyanobacteria also linked to climate change as well. We didn't specifically look at it for this project. It was a bit outside the scope of this particular project. It's something we could potentially investigate in the future, though.
Great. A question here asking about the sampling at the beaches. Is it done at multiple locations at that one beach or in one location at the beach? And if multiple locations, how do you enter that into your models?
So they do 5 different locations at a beach. This is essentially the same location every day. And then those are all those 5 data points are used to calculate the geometric mean, which is what we use for our models. We don't use the individual 5 samples, but we use the calculated geometric mean.
Great, thank you. One asking, do you have any good practice examples internationally of using predictive modeling to alert swimmers to bathing water quality? They're mentioning that they're aware of a Scottish bathing water signage project that was initiated in the early 2000s. Are you aware of any other examples?
So we know of, so that's interesting. Actually, thanks for, I see that they included the link for the Scottish study. That'd be interesting to look at. I wasn't aware of that one, but we did, we have heard of some other successful ones, which is how we came across Bayesian network analysis from a study done in New Zealand, where they found that the Bayesian network approach was the most accurate in terms of predicting, where they looked at different methods. And so, yes, we're definitely looking beyond North America for examples, and found that that was quite an interesting approach, that which is what we're applying now. There have been other methods used also here locally. So in Toronto, they've used artificial neural networks, which is also a type of artificial intelligence, with some accuracy, in the 70s, 80%. So we're hopeful that this method will be more accurate, like what they found in New Zealand. But thank you for sharing this, Juliet. Definitely take a look.
Thank you. I've got a question here asking, have you considered expanding this study to include more river systems? I think a logical question is whether lake models are able to be extrapolated effectively to river systems, and there is good predictive model for river systems being established in Ottawa that could be included.
Yeah, I think we wanted to start out with lakes, and by going to Manitoba, we'll get another inland lake, and then again with the marine waters. I think looking at river systems would be a good idea again for possibly expanding this in the future and seeing do these results translate. I would imagine it would be quite a bit different in terms of what factors affect those types of breakwater exposures.
Great. A question asking about the birds, wondering how strong of a relationship did you find with bird abundance? And could you comment on the epidemiological concerns associated with this specific kind of contamination?
Yeah, so the birds was quite a strong variable, as I briefly mentioned, in Toronto. Now, unfortunately, it wasn't collected in a very accurate way that we could dig into it too much. It was more of a visual observation. And again, I'll point out that it was birds that were essentially right on the water line, so right on the shoreline. So if there were some birds hanging out over in the sand or by the trees, they weren't included. It was just the ones that decided to wander over to the water. So again, not over accurate, but just gives you a sense of beaches that might have more bird presence, mostly seagulls. But it was definitely found to be important. And in the literature, waterfowl presence has been found to be important. Microbial source tracking has also found that it's an important contributor to E. coli levels. And there's been a few studies done in Toronto, specifically at Bluffers Beach, where they found that actually addressing that improved water quality. And so definitely an important variable that we'd like to hopefully try to factor in more as we explore this area.
I just wanted to add as well quickly, based on quantitative microbial risk assessment modeling done in the US, they actually believe that even if that basically the rates of gastrointestinal illness is less likely to occur with bird contamination compared to human sewage or cattle manure, tend to be much higher risk just because the pathogen load and more likely to have enteric viruses in human sewage, and then cattle like toxin producing E. coli. So those are believed to be the bigger kind of causes of AGI. So even though birds contribute to E. coli, that E. coli may not be as likely to get you sick.
That's interesting. I've got a question here asking, have you also evaluated new rapid analysis technologies using enzymatic methods such as the coliminder, which gives a result in 15 minutes?
We haven't specifically looked at this, but this is definitely very interesting. But yeah, no, this is not something that we've explored yet.
Yeah, and I think as we expand our project, we're definitely interested in how technology expands and how we can take that into account as we move forward with this research.
Great. Got two questions here about your expansion into BC. One asking, have the sites in BC already been selected? And if so, what are they? And then second asking about the salt, how will the salt content in the ocean impact E. coli levels?
Yeah, so we have selected the sites. We're going to be looking at Kitsilano Beach and English Bay are the two sites that have been selected. And salination is definitely something that we are very interested in exploring. So stay tuned and see how that does affect our water quality. It's definitely a variable that we're going to be including in our models.
And following from that, we've got someone asking, will you be moving to Enterococcus for marine waters?
So Vancouver Coastal Health actually uses E. coli. So we're going to be using what they're already collecting, but yes, some other jurisdictions in BC are using only Enterococcus. So because Vancouver Coastal Health is using E. coli, that's what we're going to use.
Good stuff. Asking, by using the lagging reports of AGI from Telehealth, is there an assumption that a certain percentage of the population is using a given beach?
Yeah, so here what we're trying to find is potential trends. Again, we can't know if the people who access telehealth actually visited the beach, but we're trying to find a trend in rainfall and AGI. So any symptoms associated with AGI and potentially relate that back. But again, there's no way to be certain for sure. It's essentially just looking for environmental trends.
Okay, great. I saw another AGI question. Another AGI question was, AGI and Telehealth in Niagara says, I thought you stated that rainfall did not impact beaches as directly as you thought it would have. So could we be seeing private wells that are impacting by rain rather than the beach relationship?
Yeah, it's a possibility. Again, we don't know if it was due to people accessing the beaches or just, other ways that they're exposed to this heavy rainfall that is causing illness, or if it's just, coincidental again. So it's difficult to know that, but at least we are capturing a potential environmental trend that we're seeing here, that people are potentially more ill after extreme rainfall.
That's great. I love all the questions coming in today. This is fantastic. Please keep them coming.
Mm-hmm.
Got a question asking about the turbidity, saying, did the sampling methods for turbidity impact your ability to add this parameter to your predictive modeling? So saying like some was visual observation versus using a turbidimeter.
Yeah, it was great that Niagara collected it as an actual quantitative value. So they have turbimeters that they use right on site, and then they test it right there. And that actually gave us a value that we're able to use quite confidently in our models. So we're quite happy with the Niagara data. With Toronto, it's just a visual observation, but at least we wanted to see if that direction of the relationship was similar to what we were seeing in Niagara. So, clear, cloudy, murky, as it gets murkier, is that direction of the relationship the same? And we found that yes, it was, but there is a limitation to how much we can use that variable in Toronto, absolutely. Whereas in Niagara, we're a little bit more confident with how we can use it in the predictive models.
Okay. We've got one asking, has there been any comparison between predictive models and instances of GI illness that could be traced back to recreational water?
I'm not sure if I understand.
Okay. I think maybe it was getting at like with the AGI, we're not sure if the people who are calling in sick from telehealth had been using recreational water. So are you aware of any studies or anything out there where we're actually able to see a direct link between people who were using, freshwater beaches and then were becoming sick with GI illnesses later on?
Yeah, so what we did here was more of an ecological study relationship, but yeah, there has been a lot of more cohort type studies where they actually do a more prospective type approach. And yes, there's a lot of evidence from mostly the US, many other countries as well, where swimmers, people going in the water have higher rates of illness than people who are not doing that. So yeah, both from exposure to water as well as beach sand can also make people sick.
Well, that's interesting. How does exposure to sand make people sick? That's a new one for me.
So yeah, that's kind of a more emerging area as well, but beach sand can be also quite heavily contaminated with fecal bacteria and pathogens. And the risk is mostly with children who are, again, digging in the sand. They might get sand in their mouth, consume some of that. So it's kind of the same process as the water, but yeah, sand contamination is also something to kind of maybe that's not received as much attention as water quality in the past, but can also be a factor.
Yeah, no, that's something that's really interesting. I'd love to sneak in a question of my own here. Just asking about your relationship of working with the public health units on this. What has been their openness to looking at using predictive models in the future for their work with recreational beaches?
The units have been great. They've shared their data, and they've also been quite involved in the publication. So they're also our co-authors, and we communicate with them regularly. But they are quite excited about the possibility of predictive models if they are accurate. Both regions have tried with different predictive modeling in the past that weren't overly accurate or were just not financially viable. And so I think they're quite open to something that will help them be able to monitor water quality a bit better. So, and we're definitely working closely with them as we go through.
I'll just add to Johanna, it's been fantastic working with these health units, and these health units do gather a lot of data on this, and so to make that data useful, I think is very important to the health units. And the limitations that Ian spoke about in terms of the timeliness of laboratory results and the inability to have that sort of real-time decision-making is something that, we're really striving to work with the health units to help them be able to do that with this research.
And I see that as a really great partnership. It's really exciting to see what you have coming down the pipeline with these new partnerships in Manitoba and BC. We've just got a few minutes left, so I just want to see if you have any last words that you'd like to share with our attendees today.
Well, I like the comment about the fear of swimming in Toronto with the dead fish floating. Somebody that grew up near Toronto and I'm in Toronto right now, definitely that has always been the perception, but the water definitely not as poor as we thought it was, at least not anymore. But we do see water quality improving in beaches, and our goal is to help the public health units monitor that and hopefully come up with a way to be able to make a more informed decision that is hopefully more accurate than what's currently being used. And so we think the 4 units that are going to be helping us answer this question in the Canadian perspective, because we have quite limited data in a Canadian context. So we're quite excited about having this project help us answer that.
Yes, it is. It's really exciting. I'd love to have you come back to our webinar series in a year or two to share your results from your work with those new sites. Sure. That's great. Well, I'd like to thank the 3 of you for joining us today. It was a really interesting presentation. We're really happy that you took the time to share that with us. And thank you to all of our attendees for coming and joining us today. Stay tuned. We've got more infectious disease and climate change webinars planned for this spring and the fall as well. So I'll be sharing those in the future. And if you could please take a few minutes after the webinar, once you close the Zoom, a window will open in your browser just with a short 5-minute feedback survey. And we'd really appreciate getting your feedback on how we can continue to make this webinar series as interesting as possible for you. So thank you all for joining us today, and have a good rest of the day. Bye.
Thanks, everyone.
Thank you, Julian.
Bye.
Bye, thanks.